My name is Bob Holtzman. I'm a neurosurgeon, and I'm joining the group Neurological Surgery PC. In the course of an ordinary conversation, I can actually, and I tell patients that I do this, I can actually perform a mental status examination and most of the neurological examinations. So while I'm talking to you, I have a feeling of your responses to me. For example, latency of response is the key to the mental status examination. So if you have any delay in responses to me, I know there may already be some kind of a problem. And I pick up on this. And then while I'm looking at you, I'm looking at the symmetry of your face to see if there's anything that's offset on one side, so that if your eyes are not moving properly, or your face or your smile is not quite symmetrical, or your tongue seems to be going off to one side or the other, then I can pick that up just by looking at you. And then I watch the movements of your arms and legs. I watch how you walk into the room. I can tell if there's an abnormality on the neurological examination almost by watching you walk and how you hold yourself in the chair and what your posture is like. And so then I confirm these things. So I do cranial work, spinal work, and peripheral nerve work. My general experience has been that patients refer other patients. So that if Mary gets better and she tells someone in her neighborhood that she's had this doctor, and not only has the doctor taken care of her medically, but he's been available to her afterwards to follow up, because the surgical procedure is only part of the recovery process, and that he's been concerned enough to take care of details concerning her insurance, and then been able to provide her with some kind of physical therapy or rehabilitation therapy, but in the course of this, never losing contact with her, because that contact between the patient and the doctor is actually the most important element in medicine. And even though you're in a highly sophisticated specialty, you should never lose that particular relationship. I've been interested both in the management of brain tumors, vascular diseases of the nervous system, and particularly head trauma. I spent a good deal of my time in the city hospitals managing gunshot wounds, stab wounds, and major head injuries from automobile accidents. I've spent a lot of time as well doing spine surgery, both reconstructive surgery for degenerative disease, and the management of tumors and vascular malformations of the spinal cord, and also doing decompressive procedures for entrapment of peripheral nerves, including the nerves themselves and the plexuses, both the lumbosacral plexus and the brachial plexus. It's a very diversified but highly sophisticated group of neurosurgeons who have apparently the unique ability to work together. I come to this group now with the interest of continuing this practice of neurosurgery, and look forward to a very interesting time on Long Island.